Good morning. I'm going to be explaining to you some type of handpieces that we use in the dental office. I'm first going to explain our high-speed handpiece. Our high-speed handpiece is used for restorative procedures, like fillings, crown, prep, or like veneers. And we use friction grippers for this. And in the back of these, in the back of the handpiece, there's like a little lock, so it can either be pushed into lock, or there's gonna be like a button, and like you put it in and you release the button and it locks it for you. Or sometimes we can use a burr lock, and it just helps lock in the burr in place. It kind of like snaps it into place. And for a high-speed handpiece, we do use, it does shoot out water because it speeds at such like a high rate that we can actually damage the pulp, or the tooth gets hot and it will actually hurt our patient. And the water is also good for when there's too much debris or too much blood and the doctor wants it like washed out. And this does have to be autoclaved. That's very important because since the high-speed handpiece does shoot out water, sometimes like when we stop it in the patient's mouth, it might suck up like blood, debris, saliva, anything in the patient's mouth. And so after every use of the patient, we should be autoclaving these. And sometimes, so when you screw these on to the dental unit, they have these little things in the back. And sometimes before going into the autoclave, we have to lubricate it so it doesn't rust and it doesn't like wear away or anything. And our slow speed handpiece looks like this. We use this for like coronal polishing. You can attach like a prophy cup or prophy brush, like disposable or not disposable. And we can use this to adjust crowns or retainers as well, besides polishing the patient's teeth. And for the slow speed, it doesn't help remove like extensive decay because it is like slow speed, so there's not so it's not like it can like penetrate the tooth or really clean the tooth. It's just almost like a surface clean, but it does help remove decay. And also with the slow speed, this slow speed, in order for you to attach a burr, you have to use a contra angle. And a contra angle kind of looks like this. It's like this little attachment in order for you to put the burr onto it. And they have these like little latch type. And with that little thing right there, you flip it up, you put the burr in, and then you push it down and it locks it for you. And most of the time the burr will not come out at all. And the next attachment I'm going to be talking about is the air abrasion attachment that kind of looks like this. This is a little hard picture, but it's right here at the top, and it looks like this. It's almost similar to a sandblaster. There's these aluminum oxide particles that help remove the decaying stains. And this one as well, we don't use this one for extensive decay in the patient's mouth because it is, in order for it to actually penetrate the tooth deep like a high-speed handpiece does, it penetrates it too slow. And so for the doctor not to waste time, for us not to waste the patient's time, we're not going to use something that is going to take forever to help to go ahead and clean out the extensive decay. So this one as well is for like surface stains and just for regular decay in the patient's mouth. This was never really used back then. Now it is used, not a lot, not as popular as the slow speed or the high speed, but it is used in dental offices now. And our next one is the laser handpiece that looks like this. We have a little right there. And basically, like what a laser does, it has that red light that cuts through tissue, or it can cut through like a tooth structure and remove decay. And for this, we actually do not have to numb our patient. And then this is also used just for to remove lesions and tumors. Sometimes when people have like tumors on their gums and the inside of like their mouth, and also to just remove extra tissue. This also does not go will not go deep into like the extensive decay. It will only be used for like surface stains or like surface decay that our patient has. And the next one is the ultrasonic scaler. Now this is really to remove calculus and other debris, sometimes like cement, or sometimes when people's gums get like all gunked up with plaque, and either like on top of their gums or even under the gums, they use that. And the ultrasonic scaler like uses like pulsating vibrations and sound waves and a bunch of water to like basically scale that out. So this is mainly used, it's called root scaling or root planning, and it's usually done with people with extensive decay, like the plaque is gunked up on their teeth, and they go in and they just scale it all off. And it's crazy because when they're done and you see without all that plaque, their gum is completely red, ruined, it like shrunk to almost like their root. And so the ultrasonic scaler is used for super extensive like plaque calculus and all that. And with this as well, this one will go into ultrasonic machine, which the most popular one is the Cavitron. And that's about it for the handpieces. Thank you.